Yeah, so welcome everybody. This is Dr. Divyam Goswami along with my dear friend Dr. Bhavya Bansali, and we are hosting this DiGo Talks session. And our special guest today is Dr. Samir Heble. He is a psychiatrist and psychotherapist from Australia. He is the executive director of medical services and uh, Western Australia Country Health Service, joining in from Western Australia. Welcome, Dr. Samir.
Thanks. Thank you, Divyam, for that introduction. Yes, I'm Samir Heble. I'm currently in Perth, Western Australia, and I do want to acknowledge Dr. Divyam Goswami. And it was great, Divyam, to read about all the great things you've done as far as community service and the connections. I was very impressed to read that there are 500 plus members globally in 17 countries. So that's a great initiative. So thank you and your colleague Bhavya as well for the DiGo Talks. Yeah. I want to acknowledge Dr. Richard Newton as well, who's in Melbourne, and my colleague here. So thank you, Richard, for joining today. So it's a great honor to have you as well. It's a small group who are actually interactive. So that's great too, because I can then focus on the session today for this group, bearing in mind that it's going to be recorded as well. So I'll adapt for both, yeah, for those who are going to be online and watch it later, as well as for those who are online right now, yeah. My grandfather used to always introduce himself as a poet, yeah. And there's very few people who do that. So I'm going to be sharing some of his memories as well, which are sort of lesser known. Yeah. So he always used to introduce himself as a poet. So he used to say, "I am poet B.B. Borkar." Yeah. And by that he wanted to elevate poetry to a pedestal, to a height that was required and essential. So he he made poetry divine. Yeah, he made poetry divine, and he always used to have a shawl around his shoulders, almost representing the royalty status of poetry, and that was there with him all the time. Yeah. The other thing I can vividly remember as a young child is poetry for him was not just poetry. He used to dream poetry. He used to sing poetry. He used to breathe poetry, and every poem of his had his own song. Yeah, there's quite a few of that on YouTube. So if you have a look at some of his poetry, he used to actually sing the song, and he used to be in the moment there, while singing the song. Yeah, and there was a real depth to it. Yeah, the depth to the poetry, very vivid and sensuous. So he got the India's highest literary award in those days in 1967. So that was the Padma Shri, and his statue is there in Goa. He had a state funeral as well when he passed away. Yeah. As a young child, all the famous poets used to come to visit him in the house and write poetry together. And he used to take me along with him to visit some of his poet and poetesses, they used to call them, the female poets and poetesses. So I remember going many times with him as a small child, writing poetry together, him writing poetry with his poetry colleagues. I'll tell you some of the names, the very famous ones. Some of them are still alive. So there was Vasant Bapat, there was Mangesh Pargaonkar. There was quite a few. Pula Deshpande was there. There was, yeah, so all those influences had a strong influence on me as well. Yeah. I went to, as I was growing up, I had a parallel career as well. So I was studying French initially because Goa is a Portuguese colony, and French has a strong influence there as well. So I started studying French, and then taught French at the Alliance Française for 7 years or so. Then lived and worked in France for a little while, and then in New Zealand for another 10 years. And last 15 years, I'm in Australia. So these are all the influences I've had in my life. Yeah. So the poetry session I'm going to be doing today, I'm going to be using three techniques to do in this group today. So with you all, four of you all. So I'm going to show you a little bit of sensory poetry and how I use it in my own clinical life as well as my leadership role. And then I'll do a little bit of Japanese poetry as well, real live Japanese poetry. It's called Haiku. And then we'll do a little bit of Vietnamese poetry as well by Thich Nhat Hanh. Yeah, he's passed away in 2022, but I've been strongly influenced by Thich Nhat Hanh as well. So that's my introduction. So we'll go into the first type of poetry, and it's sensory poetry. Now, why do I use poetry in my life? Yeah, personal life and professional life. Firstly, because I've been influenced by it. But secondly, I find that it brings me quickly to the present moment. Yeah, and the types of poetry I'm going to be showing you today is will show you as well, and you'll be able to feel it how you can quickly come to the present moment, and it almost grounds me soon. Yeah, it keeps me grounded, it keeps me connected, and it gives you the sense of inner calmness and bliss as well, both in my leadership role, and I've worked in a large organization with 13,000 staff. Yeah, where I have to deal with lots of different types of issues, similar to what Richard's doing. So it helps me with that. Yeah, but I'll show you some of those techniques. So I'm going to start the sensory poetry technique first, and I know different. All of you all in a different location. Richard, you're in a room, isn't it? There, yeah. You're in a room there. Do you have any window there, Richard?
Yeah.
Do you do with a little bit of view there that you can
Yeah.
see something? Okay, great. Yeah. And what about you, Divyam? Are you in a room with a window?
Yeah, I'm in a room and it also does have a window.
Okay, and you've got something to see in that window?
Yeah.
See outside? You do? Okay, yeah. Great, yeah. So the first technique I'm going to be showing you is sensory poetry, and we'll try and do a few of those. We've got how much time remaining? At least another 30, okay, 45 minutes or so. Okay, we'll do a little bit of sensory poetry. So sensory poetry is using all your five senses. So it's your vision, it's your hearing, it's your touch, it's your smells, and your feeling as well. And we're going to use all our five senses. And I'm going to slowly moving you from a topic to another, but we'll do a particular topic first. I usually like to see with the group what's the topic we're going to choose. So it's good to start on a positive topic first. Yeah. So let me go around the group. I'll give you some examples as well, so it's not to be completely. So a topic we can choose is happiness because it's a common topic, happiness. But I'm just going to go around the group. Richard, is there any particular topic that comes to your mind that you'd like to explore today? Yeah.
Are we talking? So I'm just struggling to understand what kind of topics you might have in mind. Happiness, of course, is a massive topic.
Yeah.
What else are you looking for?
One of the essences of poetry is not to be too rigid, and not to edit too much. So I'm going to keep it quite open, actually, because that's the magic of it. Yeah. So what comes to your mind right now? Yeah. When I actually ask the question as well. Yeah.
Okay. Well, of course, it's word association. So you say happiness, and I'll say contentment.
Contentment. Great. Yeah. That sounds like a good topic. Let's look at two or three, and then we'll choose a particular one. What about you, Divyam? When I asked the question, what's the first thing that struck your mind? Yeah.
When you asked the question, I thought of a poetry, which is one of my favorite poetry in Bangla, and the topic came to my mind was freedom.
Freedom. Okay, great. Is Bhavya there as well?
Yes. So one word came to my mind when you asked the question, and that was peace.
Peace. Okay. Yeah. So contentment and peace, somewhat similar. So let's go with contentment for today. And we'll try and explore that in a sensory way. Okay, so the first thing we do in sensory poetry is if you've got a page, do you have a page and paper there? Page, paper,
Yeah.
pen? Yeah, okay. So if you can just write the word contentment as the top of the page. And on the first line, if you can write contentment is, the more unedited it is, whatever comes to your mind, the more it's going to be magical as well. Yeah. So when I say the word contentment is Richard, what's the color that comes to your mind right now? What color are you looking at here or feeling?
So I have a bit of colour blindness, I'm afraid, Samir.
Okay.
So that's not a great question for me, because it's either going to be blue or black. Do you know what I mean? Blue or grey?
Yeah. Blue or gray, did you say?
Yes, blue. Let's go blue.
Color is blue. Great. Yeah. And when you said blue, was that a particular hue of blue, Richard? Dark blue, light blue?
A light blue.
A light blue. Okay. Contentment is light blue. And was there a particular image associated with that blue? Were you in a particular location?
I think it's the sky.
The sky. Okay. So contentment is blue, light blue, like the sky. Yeah. And what sort of a day is it? Is it a summer day? Is it a
Autumn.
autumn day? Yeah. So contentment is blue, light blue, like the sky on an autumn day. What about you, Divyam? Contentment is?
Contentment is white, and I imagined of being on a beach on a summer day.
Is it a special occasion? Any particular occasion?
No, not a special occasion. It appears to be a regular day. But it appears to be a regular day, but I'm just out on vacation.
Out on vacation. Okay. So contentment is blue, light blue, like the sky on an autumn day. It is white on a beach on a summer day, a regular day, out on vacation. How does contentment sound like, Bhavya?
Yes. It gives me a soothing effect. I mean,
A
it sounds
soothing
very
effect.
peaceful, and it's like a music to my ears.
Are you thinking of a particular person right now?
Sorry.
Are you thinking of somebody? Is somebody coming in front of your eyes right now? A particular
Yes,
group of people?
definitely.
Who
It's
are
my
they?
it's the face of my
Sorry,
girlfriend coming in my mind.
face of your girlfriend, did you
Also,
say?
yes.
Great, yeah. So contentment is blue, light blue, like the sky on an autumn day. It is white on a beach on a summer day, a regular day, out on vacation. It sounds like peace, a soothing effect, very peaceful, music to my ear, my friends. What smells come to your mind, anyone? Divyam, how does contentment smell like? Yeah,
It's a fruity smell.
a fruity smell. Is it a particular occasion? Are you there somewhere right now? Are you thinking of something right now that makes you feel that smell?
Yes, I think I'm feasting, but
Feast.
again,
What's the festival?
it's not festival again. It's just a regular day, and it's again I'm on vacation.
Regular day vacation. Great, yeah. What about you, Bhavya? What's the smell for you?
It's like lavender, and I'm in Greece eating Greek food on a beach.
What does contentment feel like to you, Richard, to touch? What is it like to you for touch, Richard, contentment?
Soft.
Soft, yeah. Is it got any particular texture as well? And are you thinking of a particular object?
No, linen, soft linen.
Soft linen, okay. And what does that remind you of, Richard, the soft linen?
Lying in bed, comfy.
Lying in bed, comfy. Great, yeah. So contentment is blue, light blue, like the sky on an autumn day. It is white on a beach, on a summer day, a regular day, out on vacation. Contentment sounds like a soothing effect, very peaceful. It's music to my ears, with my friends. Contentment smells like feasting on a regular day, on a vacation. Contentment smells like lavender, Greece, Greek food on a beach. Contentment feels like soft, soft linen, lying in a bed, comfortable. Contentment is, what's the first word that comes to your mind, Divyam? When I say contentment is,
Peace.
Bhavya,
Yeah, the same word, peace.
peace. And Richard,
Enough.
enough. Good. Well, that's a good word to conclude this poem. But I'm going to read it out again and we can spend a little bit of time again on it. So, contentment is blue, light blue, like the sky on an autumn day. Contentment is white on a beach on a summer day, a regular day out on vacation. It sounds like peace, a soothing peace, very peaceful, music to my ears with friends. Contentment smells like feasting on a regular day on vacation. Contentment smells of lavender in Greece with Greek food on a beach. Contentment feels soft, like soft linen, lying in bed, comfortable. Contentment is peace. Contentment is peace. Contentment is enough. So, so that's an example of a sensory poetry. Remember, this was not planned. Yeah. I didn't come with an agenda. This was entirely on the spur of the moment. Y'all didn't know what was happening. Uh, and that's the beauty of sensory poetry. Every one of us has this poet inside us, and how we can use that poetry to explore something in the present moment as well. I'll show you how we can expand on it more as well to work further on it. Yeah. Now, how do I use it here in real life? Yeah. So I was doing consultation liaison psychiatry as well. So when I was seeing a lady with Parkinsonism, she had. Firstly, you can't use it for everyone. You have to see for which type of people you want to use it for. She was somebody who, after establishing a good rapport and a relationship, felt she could work on some of her anxieties and fears with me on this particular using this particular technique. So the three things she wanted to work with me on this was hope, because she was going through a chronic illness and she wanted to work on hope with me. She wanted to work on anger as well. And this was something that she felt she could use poetry to work with. Yeah. She couldn't write because of her tremors, so she allowed her husband to work with me with this poetry therapy. So it wasn't a 10-minute session like today, but we worked on a particular topic for a couple of weeks. So we explored every topic, and the metaphor I use is like the onion. The onion peels. Every time you peel something of the onion, you go more into the deeper part of it. Yeah, and that's where the healing occurs. Yeah, the more you uncover, and the more you remove a peel of the onion, the more deeper you go inside. Yeah. There's a few words that struck me today, which in the next few sessions I would have liked to explore with you. Uh, I think the word regular came quite often as well in today's session. Regular. So that's something I would, with the person's consent, your consent, Divyam, if I was to do this with you individually, that was something that I would have explored with you. And that's a great word because there's lots of micro moments, I call them, uh, lots of nice things that happen to us on a regular day. Yeah?
Yeah.
And how do we capture all these micro moments in a regular day So that's something that I would have worked with you on a regular day. The word vacation came as well quite a few times. So that's another one I would have worked with. Enough is a good word. I would have liked to work on the word enough. Even the word colorblind was a good one for me. That's something I would have liked to work on as well. The best times for me have been the times of silence. Yeah, the best times for me have been the times of silence, and it's the unsaid, the unwritten that poets are more fascinated by. Yeah? That poets get more fascinated by. Yeah? So that's how I use poetry. So that is an example of a patient in consultation liaison psychiatry. In my other patients, I have found them useful for anxiety and depression, not in the acute phase, but in the sort of recovery phase. In psychosis, I have used it as well. I do have a patient with schizophrenia who also happens to be a poet, and he's in a chronic phase, so his condition itself is stable. So I do use poetry therapy for him, and in my leadership role, I use quite a lot as well. I just recently did a workshop about a month ago for a large audience on leadership, where I use it for reflection, supervision, and contemplative leadership practice. Yeah, I'm going to take a pause here because I know you might be having questions. Yeah, so we'll take a pause after every technique. Yeah, anything that you felt, experienced, and remember, there is every experience is an experience. Yeah. So there is no right or wrong experience of poetry therapy. Yeah. The essence of poetry therapy is to be mindful, to be non-judgmental, and simply live and breathe the moment. Yeah. Simply lead and breathe the moment. Yeah.
Yeah, Dr. Samir, I was impressed by how spontaneously we created this poem, and it came out of contributions from everybody, and we were able to sort of draft a poem. So I was impressed with the spontaneity of it.
That's right. And every time it's a similar experience I have, because people say, "Oh, do I have to be a poet to come for a poetry therapy session?" And I said, "No. Everyone is a poet." And there's two things I believe, genuinely believe. One is everyone's a poet, and I'm using it in a metaphorical sense. Everyone is a poet, and everyone is grand. Yeah, everyone is grand. Everything is grand, and the universe is grand. So this is the essence of poets and poetry. Everyone is grand. Everything is grand, and the universe is grand. Yeah.
Yeah, and I just wanted to ask that you said it is a technique. So is it a part of therapy, or I mean, do you do this in one session, two session? Is it a structured therapy or something like that?
Yeah, it can be done both as therapy, but it can be firstly it can be done for the others, but it can be done for self as well. It's always good to do for self first, because unless you have come to know yourself first, not fully, because you're always exploring yourself, but you have to understand yourself to some extent before using it in others. So yes, it can be done as a therapy, not one or two sessions. So if I was to doing it in the patient with schizophrenia, it's ongoing. But it's not the only form of therapy I use, because, of course, in schizophrenia, you have to use pharmacotherapy and other therapies as well. So it's an add on tool that I use because of my creative interests. Yeah. But it's not the main form of therapy I use for psychosis. Yeah. And the timing has to be right as well. The timing and the patient has to be right as well. The most important thing I found, Divyam, is for me, it helps with the patients. It helped in the relationship building because it creates a sense of authentic connection with both myself and my relationship with them. Because I've also shared with you some of my most intimate thoughts in the last 20 minutes. Yeah, and you too as well. So thank you for doing that. Yeah.
Can I comment rather than
Yeah.
question and see
Yeah. Go ahead.
what lands with you? It feels to me as if this is a very nice way of helping people shed their skin a little bit, shed
Yes.
their persona,
Yes.
and present themselves, as you say, more authentically, which I suspect
Yes.
is becoming more and more important as we become more and more, as the whole community develops more and more false selves, as we spend more time online and present ourselves in a way that we want to be, or want
That's
to
right.
feel we should present ourselves rather than the way we really are. So I love that metaphor of the peeling of the onion, which we use in
Peeling of
many,
onion.
many different ways. But this feels
Yes.
actually quite literally, not quite literal, but much more
Yes.
concrete. You're actually peeling away some of the defensive layers to allow people in a safe space, and the mutuality makes it a safe space in which you can do some work, I would have thought.
Yes. Thanks, Richard, for sharing that. Yes, it's the shedding of the skins, and sometimes the new skins come as well. So it's not that skins only get lost, but new skins come as well, and there's new insights that develop every time as well. I'll share something with you actually. I did a poetry therapy session with a group of cancer patients. So I do a lot for voluntary work for cancer patients as well. These were all terminally ill patients. So I did that for 3 months of their life. Yeah. And can I say I've been working for a long time, like Richard, in mental health, but that was the happiest moment of my life. Yeah. And the terminally ill patients were the happiest people I've seen. And yes, they were the most happy people I've ever seen. And each one of them wrote a poetry on the last day for me. And they put it in a nice wooden box and presented as a gift to me. It was a small card with a little poem. But they were the happiest people in my life. And I did a lot of this type of work with them. Yeah. And I think that's what happened there as well, Richard. That was the uh, shedding of the skin, a lot of letting go, as well as a lot of new insights as well, that they were able to come to terms and have some sense of closure with their life as well. And they were the happiest people. Yeah.
To follow up on Richard's comment about shedding the skin, I think this has a lot of similarities with the psychodynamic process as well.
Yeah. Yes. Yes. Okay, I think it's a good segue to go into the second topic because I said I was going to show you three things.
Yes.
So the first one we did was more to come into our present senses. The second one is quite a simple one as well, which I find useful to help us pause and connect to different concepts as well. Sometimes to similar concepts, but sometimes to different concepts as well. Have y'all experienced haiku before, Richard? Haiku is the Japanese poetry. If not, that's
Uh,
fine too. Yeah.
I belong to the Tony Abbott Haiku group on Facebook, where we write haiku about Tony Abbott.
Okay.
Not
Yes.
usually very flattering ones, mind.
Yeah. So only about Tony Abbott. You're right. Okay. Yeah. What about Divyam and Bhavya? Have you heard about haiku? No?
Yes, I've heard about haiku. I think it's a special type of poem. It's a type of short poem, if I can say so.
Yeah. Okay. Yeah, that's a good start. So haiku is Japanese poetry, and it helps us quickly come to you know how you spoke about the regular day, Divyam?
Yeah.
And regular day, you have lots of these micro movements. All of y'all have said something to me today, which I've learned. So these are all micro moments for me as well. And it's all these micro moments which ultimately determine our destiny. Yeah? So destiny is a collection of all these micro moments. Yeah. So haiku lets us acknowledge these micro moments and take a pause as well. And with that pause, there's another insight that develops as well. So haiku is traditionally 3 lines. So if you have your paper again, so it's if you can just write first line, second line, and third line. This is the English version of haiku, so it's a slightly bit adapted. So the first line has 5 syllables. For example, I'll give you an example right now as I'm looking through my window and I can see because I'm from Goa, we planted some palm trees. So out of my window, I can see palms actually. So the first line for me is palms in the garden. So that's 5 syllables. Gar and den is 2 syllables. So palms in the garden. So first line has always to have 5 syllables. Yeah. So palms in the garden, 5 syllables. The second line has 7 syllables. So when I see the palms in the garden, something else comes to my mind when I see palms in the garden. So the first line and the second and the third line is connected to the first line. But after the first line, there's a pause. So when I see the palms in the garden, it's a micro moment for me. Because right now, in this moment, I'm seeing the palms in the garden out of my window right now. So that's a micro moment for me. It's a special moment because you don't see many palm trees in Perth, but I've got one in front of my garden there. So it's a micro moment for me. It's special to me. And the Japanese use certain symbols for the pause, but the English version of the pause is a dash. Yeah. So you can put a dash after that. So palms in the garden and then a dash. Yeah. So the second line has to have 7 syllables, and the third line for me is 5 syllables. So it's 5 7 5. Yeah. So second line for me, what does palms in the garden? What's the other image that comes in mind? For me, it's Goa, monsoon rains, and red mud. So it's Goa, monsoon rains, comma, red mud. So that's 7 syllables. Goa, monsoon rains, red mud, 7 syllables. And the third line is reliving childhood. Reliving childhood, 5 syllables. So my haiku is palms in the garden, dash, Goa, monsoon rains, red mud, reliving childhood. So that's an example of a haiku. So there's a few things in a true haiku. One is it has to have what's called as a nature word in one of the lines. There has to be a nature word, and the nature word I have used is monsoon. You don't have to use it, but it's good if you want to. And the other part of the haiku is the pause as well. And the pause I put by a dash, but it could be a few dots, or it could be a colon or a semicolon or a mark or an exclamation mark, something that helps you pause with that micro moment. Yeah. Let's see if we can do a little bit of the haiku and capture a micro moment right now. See if you can see something through your window or even in your room, actually, and whether something triggers something special for you by looking at something or holding something. Maybe you can hold something and see what comes to your mind. Yeah. Even your pen, you could even hold your pen and see if that triggers something special for you. If you're holding something, let me know as well, and I can hold the same similar thing if it's something similar I have here. Should we try pen since all of us have a pen? Yes, let's try a pen. Okay, all of us are holding a pen. So maybe hold the pen in your hand firmly, and maybe close your eyes for a few seconds and see what triggers your mind. Yeah. And maybe take a deep breath in slowly and release out slowly as well. So let's do a haiku on a pen. Let's see if we can do this one, but I'll facilitate this conversation. Divyam, what What was coming to your mind when you were holding that pen?
Yes. So
You don't have to do the haiku. I was just exploring a conversation.
yeah. So what was coming to my mind was the freedom of expression.
Oh, wow. Freedom of expression.
Like I was thinking,
Freedom of expression.
pen becomes an instrument of freedom of expression.
Good. So, and sometimes in the haiku, you can cut some of the prepositions and articles as well. So, freedom expression is 5. So you could put freedom, comma, expression. That's 5. Yeah. So that could be a good first line. So pen and freedom expression. So that's a good first line. And what was the second thing you mentioned? You just said something after that. Yeah.
Yeah. So pen acts as an instrument of freedom of expression. So that is what
Okay.
I'm saying.
Okay. We'll explore a little bit more. But is Bhavya there?
Yes.
And what was it? What coming to your mind, Bhavya, when you're holding the pen?
The thing that came to my mind was the image of me being awarded with a Best Speaker award when I was in Jaipur. So a sense
Mm-hmm.
of achievement, a reward, and contentment were the three words popping up in my mind at that time.
Okay. Achievement. So that could be a first line as well, Bhavya. So pen could be the title. Achievement, reward is 5 syllables.
Yes.
For me, there was something special as well today, Richard, and it was actually having all of you in the room today. Yeah, because all of us are holding pens, and you're all coming with a rich background. You've all had special and rich journeys. Yeah, and even though we're only 4 of us today, I was really feeling this richness and the honor of holding the pen along with you all as well. And you all have dreams and aspirations. Divyam, Bhavya, you're young. You're young. You have dreams, aspirate. We have too. You probably have more than us. Your dreams and aspirations. So I was really feeling honored to be amongst all of you. Richard, you've had a rich life and journey as well. And I feel truly honored to hold this pen with you all today as well. So that was what was going through my mind as well. Everyone across the universe is holding a pen, and how privileged are we to be holding these pens? Yeah. What about you, Richard? Any insight or anything that came up after the pause of holding a pen?
So it's all, for me, this is all about the power of words and the power of the pen.
Yes.
So power.
Yeah. Okay, that could be a good third line. So the haiku could go like this: pen, freedom, expression. So do you want to share any of your haikus, Divyam? We had a few things there. You had the first line, freedom, expression.
Yes, another word that came to my mind, maybe you could incorporate that in the haiku, is rebellion.
Mm. Can you expand on that for me? Or what did you mean by rebellion?
A rebellion is like I thought of pen as being an instrument through which we can write something which was suppressed, or as if we are rebelling against somebody.
Hmm. Yeah. So that's a good duality. It's the freedom and the rebellion as well. It's good to explore the dualities. Yeah. So expression and rebellion is also a duality. Bhavya?
Yeah. So 3 words came to my mind after that. That is liberation, creativity, and expression. So a pen sorts of liberates us. I think it empowers us to express ourselves and to be creative.
Good. So it's coming more close now. Sorry. Okay. Got a good one now, which sort of summarizes what all of y'all have said. So the topic was the pen. So that would be the heading: pen, freedom, expression. Okay. And then we took a pause. Empowers and liberates, 7. The great power of the pen, 7 syllables. Yeah. So freedom, expression, pause, empowers and liberates, the great power of the pen. So that was a micro moment we had. We had the pen with us. So that was a micro moment, and that micro moment with a little bit of pause helped us get a few insights around. There was a lot of deep things y'all mentioned actually in the last 6 minutes. A lot of powerful words y'all mentioned: liberation, freedom, expression, rebellion, power, words, very deep concepts. Yeah, in a short span of time. So that's as Richard said, that's the power of the words. Yeah, and that's the power of the pens, and it was quite evident in the last 6 minutes. Because traditional healing, you don't have such profound words coming up in such a short space of time. But the poetry session allowed us to have explore such profound words in the last 6 minutes. Yeah, it takes years and years of therapy to come with these concepts. Yeah, but we were able to do it in the last 6 minutes. Yeah, so that's great. Yeah, so that's the power of the haiku, and that's how we can capture the micro moments. Yeah. We'll do quickly the last one, and then we'll take a few questions as well. So the last one is by Thich. Or should we take a pause? I don't mind taking a pause too. Yeah. Let's take a pause. Yeah.
I do have a question because
Yeah.
it
Go
does seem
ahead.
to me that this is it's a shortcut to quite deep to the
Yes.
dog meaning for people.
Yes.
Um, and and a bit like any other therapy that goes quick soon, it
Yeah.
has the great risk of side effects of hurt and harm as people reveal parts of themselves that actually they can't bear to reveal. So
Yes.
I just wonder what your thoughts are about how do you how do you keep the space safe?
Yeah. So firstly, it needs to be firstly the patient choosing it has to be correct. So and it doesn't start as a first session. So it's only through the sessions once I feel the patient is ready psychologically and psychologically minded to work in that space. So the timing is right. The patient choosing has to be right, and the relationship the person has with the clinician has to be the right relationship. So there are 3 things, like anything else. How do we keep space? Usually it's around once a week. There's a little bit of homework that goes with it as well. It's very confidential space, so I wouldn't have done in a group setting like this. This was only a demonstration. So it would have been in a individual session, and whatever comes up from the homework gets dealt with in the next session. So using this as an example for you, if I was to do Divyam, those were some of the words I would have explored with you: the regular, the vacation, stuff like that. Yeah. Uh, and then there's always time to, the pace is decided by the patient. The patient and facilitated by the therapist. Yeah. The timing is also decided by the patient as well. There are times when they might want not to have the poetry therapy as well. Yeah. And something else. But I don't do only poetry therapy. I do it as an add-on tool to something else as well. And there might be times when I might have to increase their medications, for example, if something else comes up in the poetry session. And they might choose, they feel a bit anxious and they might want to increase their medication. So sometimes that comes up as well, sometimes decrease as well. Okay, we'll quickly go to the third one and then we can take a few more questions. The third one is called Gatha. It's a different one. So that's a gratitude poem. It's spelled as Gatha. This one is not very popular, but you may have, if you read Thich Nhat Hanh, Thich, Nhat is Nhat, Han, Hanh. He's a Vietnamese monk, Thich Nhat Hanh, but very famous as well. He's written lots of books on mindfulness and is actually called, the Eastern philosophies call him the father of mindfulness. Yeah. So there's lots of important, nice things he has written, Thich Nhat Hanh, and he does gratitude poetry. A good example is we have to look at simple things. And let's take the tap of water, the tap water. So every morning we open the tap. Yeah. So tap water. Tap water. Where do you think that tap water is coming from, Divyam? When you open the tap in the morning, when you get up in the morning, go to the bed to have your first wash, and you open the tap, where is that water flowing from to come to you? Where do you think it's coming from? Yeah. Originally, yeah.
I think it is coming from the rivers.
Okay, great. Coming from the rivers, yeah. And do you think it's traversing lots and lots of beautiful lands? Yeah.
Yeah.
So tap water coming from the rivers, traversing beautiful lands. Yeah. Do you think other people are also touching that water before it comes to you? Yeah.
Yeah. And not only people, but birds, animals.
Touched by people, birds, animals. So coming from the rivers, traversing beautiful lands, touched by people, birds, animals. And then what do you think happens to that water? So it's traversing these beautiful lands, but doesn't automatically come to you. Something must be happening somewhere for it to come to you.
Yeah, it is. It is forming springs. It is forming waterfalls.
Forming springs, waterfalls. And how do you think it comes like purified to you?
That is, I think, through the government, where they purify it through some pumps.
Yeah. And do you think millions of people would have been involved in that process? Yeah.
Yeah.
Millions of people involved to get it purified to me. And then when you wash, okay, so tap water was the heading of the poet of Gatha poetry, coming from the rivers, traversing beautiful lands, touched by peoples, birds, animals, forming springs and waterfalls, millions of people involved to get it purified to me. And when I wash my face now, when you hear this, what do you feel, Divyam? When you wash your first face tomorrow morning, and having known that it comes from all these beautiful rivers, beautiful lands, touched by peoples, birds, animals, forming springs, waterfalls, millions of people's involved to get it purified to you. When you wash your face, what are you going to feel?
I'm feeling some sort of connection with all those people, animals, birds, landscapes.
I feel connection and I feel grateful. Yeah.
Yeah.
Great. Yeah. So that's your gutter. So the gutter was on tap. So normally when we wash tap water, we're almost in an automatic mode. Yeah. We don't necessarily think this way. Yeah. But the way you did it now, tap water coming from the rivers, traversing beautiful lands, touched by people, birds, animals, forming springs, waterfalls, millions of people's involved to get it purified to me. When I wash my face, I feel connection. I feel grateful. Yeah. So that's your gatha for it's a gatha is a gratitude poem, and it helps us quickly approach these micro moments, what you call as a regular day. Yeah. But there's lots of micro moments in a regular day. Yeah. And it's a part of positive psychology. The more we start appreciating these positive moments or the micro moments, the easier it'll be to come to terms with life. Is pretty simple. Yeah. It's made up of these multiple micro moments. Yeah. Sometimes we tend to get focused, me included, on things outside the micro moments. Yeah. So thank you very much. I hope today's session was enjoyable. There was a lot of deep concepts we spoke of as well in a short space of time. And I really appreciate you sharing some of your deepest insights and feelings with me. I hope you found it psychologically safe for you as well. And I'm very happy to be in connection with Richard, of course, who's in Melbourne, and Divyam and Pavia as well. If you would like, I have done a few for RANZCP as well, Richard. I did something, I think, a couple of years ago on dance therapy and mindfulness. And I did a poetry therapy session as well, a couple of times, I think.
Right.
Yeah, so thank
Next
you
time
very
you're in
much.
Melbourne, we should catch up and swap poems.
Yes.
To hear some of your poetry.
Yes, thank you. I'll pass on to Divyam now if you want to have any questions or concluding comments. Yeah.
Yeah, so I have a couple of questions.
Yeah.
Regarding the application of poetry therapy in clinical practice. So,
Yeah.
as I also asked earlier, that is it some sort of structured therapy? Like, how do we have
Yes.
10 to 12 sessions for CBT or IPT? So, is it that sort of therapy, or is it more casual sort of therapy?
No, there is a casual. No, there is a organized therapy. There's actually a course as well, and there's lots of journals as well that you can be. I can send you some journal names. So there's journals, there's associations, international as well as local, and there's certified courses as well for becoming a poetry therapist. In saying that, you don't have to have these courses to do poetry therapy, but it is always good to have one. Yeah. You don't have to be a poet to be a poetry therapist. Like as I said, every one of you is a. It's useful if you are, but it's not essential. But yes, there's a structure to it.
Yeah.
Yeah. So, from what I gather, there are three parts in this poetry therapy. That one is the receptive part, and one is the expressive part, and there is
Yeah.
also something called the symbolic part. So,
Yeah.
how do you maintain a balance between this expressive part and the receptive part?
Yeah, so we did a little bit of this today. So the expressive part was you were able to write for me the haiku and very quickly. I was writing for y'all, but we essentially did in the gata the expressive part as well. You were able to express, yeah. Symbolic was I was trying to work with y'all as to what does a regular day, what does this symbolize? Your regular day, yeah, and what does contentment symbolize? So that was a bit of symbolic, yeah. And receptive is what you hear. So in receptive poetry, the poet talks or reads out poems, and people sit down and think what that means. Yeah? So you wouldn't have done something with me; you would have simply listened and then tried to analyze what some of the words of my poetry meant for y'all. Yeah. So that's receptive. Expressive is when you write it, and symbolic is when we derive connections as to the words you have used. Yeah. Traditionally, it's a combination of everything, but everything may not necessarily happen in one session.
Right. Also, Dr. Samir, many of our patients, they engage in suicidal self-injury, non-suicidal self-injuries as a part of emotional dysregulation, as a part of maladaptive coping mechanisms. So can poetry therapy help process these overwhelming emotions as well?
Yes, actually, it's a very safe one because I used to run groups in New Zealand for people with borderline personality disorder. who, as you know, have a lot of self-harm thoughts. Yeah. And this was something that worked well with that particular group that I was running. I ran it for 10 years, yeah, in New Zealand. Specifically I actually trained under Marsha Linehan for dialectical behavior therapy in New Zealand. She trained about 50 of us at the time.
Right.
She was the founder of dialectical behavior therapy.
Yes. So, Divyam, would you like to answer questions?
Yeah. Another question that I had was, even I asked it earlier, that how common or what things common do poetry therapy have with psychodynamic psychotherapy? Because a lot of things that you said or you demonstrated in the poetry therapy, it appears to me, and as Richard also told, that it is shedding the skin. So is it bringing out something from the unconscious as well?
In poetry therapy, the main while some of the things may come up, the main focus is, however, remaining in the present moment in a very non-judgmental way. And even if things come up, it's again coming back to the present moment.
Yeah.
Unlike psychodynamic therapy, when you work more on the
Yeah.
past, yeah,
Childhood, yes.
yeah. Whereas in the poetry therapy, whilst things may come up, a trained poetry therapist would bring you back to the present moment. Yeah,
So mostly it is here and now, and
it's
not.
mostly in the here and now. Yeah, which is why I personally felt it worked for people with borderline personality disorder, because it helped them. Uh, whilst many of them had a troubled childhood, it helped them come back to the present moment soon. Yeah.
So if you were to list out the indications for poetry therapy, then what would be that indication?
In order of preference, from my experience of working with clinical people, I'll talk about the non patients first, like us. For us, so our self is definitely number one. Self number one for reflective practice and contemplative practice, as well as coming to terms with your own stage of life, meaning and purpose in life. Yeah. So self, I would put number one. Then if I come back to the outside the self, but not yet in the clinical world, outside the self in a leadership role, because my role currently is executive director for medical services. I have found it a useful tool to work in a leadership role as well, in terms of team dynamics, team building, etc. And when I come to the clinical role, then in order of priority, I would start with anxiety first. Yeah, anxiety first. Second, mild to moderate depression, either in the remission phase or in the recovery phase. After that, I would go with borderline personality disorder. And again, the timing has to be right and how I do it. And after that, I would put substance use disorders as well. Substance use disorders, and then psychotic disorders in remission. PTSD would also come under the anxiety disorders. Yeah. So anxiety, PTSD would all come under the category.
Is there anything peculiar to the patient or peculiar to the therapist that would hinder the process of poetry therapy?
In the acute phases, we try and avoid it. Yeah. In the acute phases, we try and avoid it. So no matter what the diagnosis is, so the acute phase, I would avoid it. If the person is not this is not for everyone, like anything else. Yeah. If somebody is not for it, then I wouldn't do it. Yeah. If you're more artistically inclined, they are more likely to do it. So there's a lot of people now who want alternative modes of therapy. Yeah, in fact, more and more. Yeah. So a lot of the worried like this, and I'm not using that in a derogatory sense. Yeah. So a lot of people with worried would want that. There's a lot of people with alternative types of treatments who have had lots of chronic illnesses. It's good for pain as well, actually. Yeah, I need to put pain in the first category, along with anxiety, pain, because it's peeling of the skin every time in the pain disorders. Yeah. In New Zealand, I did a lot of poetry therapy with pain disorder patients as well, along with the pain specialist. So she and I worked together. I was working in the Taranaki District Health Board. She was a pain specialist, and me, we did work together.
Yeah. And, how has been the adoption of poetry therapy by psychiatrists and psychotherapists there in Australia?
It's not yet fully recognized like anything else. It's considered more of a out of. Richard can tell you more about it. No, it's not yet
It
fully
didn't find its
accepted
way
worldwide.
into CPGs, did it? But Samir, I think that we bring the skills. Our work is about being in service of the person and their
Correct.
needs, and so we bring what skills we have to that. And
Yeah.
I think this is a great
Yeah.
example of that, of bringing yourself and what you have into the room.
Yes. And I'll tell you one statement that my professor of psychiatry, when I was in India, actually, he used to say, because all of us are going to see a lot of complex patients. And he said, Samir, what science cannot do, love can do. What science cannot do, love can do. And that's what I always remember. You might have all these best medicines and best evidence-based practices, but if you have got that something real and unique that only you can do, maybe that thing is going to work for them. Yeah. So that's what I think poetry is. So, and by love, I meant everything that we are doing. Yeah, what science may not necessarily be able to do. Yeah.
Yeah.
So
And
that's why I think psychiatry is both a science and an art. Yeah. So psychiatry is both a science and an art. Yeah, and equally so. Unlike some of the other disciplines, I think psychiatry in particular is science and an art. Yeah.
yeah, and following up on that, do we have enough of evidence base for it? I mean,
Yes, definitely. So I've got lots of poetry journals in my room here. Uh, yeah, there is a lot of evidence on poetry-based therapy, but not yet fully understood or taught. Yeah, even in colleges and universities. Yeah.
yeah, and you are doing a great job practicing poetry therapy. Maybe I think you'll also be generating some of the evidence.
Yes. Thank you.
Yeah, and this session will remain on YouTube forever, and it will help the young psychiatrist and early career psychiatrist to get inspired to practice poetry therapy.
Yes. Thank you. Well, thank you. I've taken a lot of your time as well. So thank you very much for sharing your own Sunday time, Richard and Divyam and Bhavya. It was really a great honor and a privilege to share all our feelings, receptive, expressive, and symbolic today. Yeah.
Yeah, we were grateful to have the hands-on experience. So it's very rare to have a hands-on experience. Everybody will teach the theory part, but
Yes.
not many people would do the practical part that you did today.
Yes, I was telling Divyam that Divyam asked me whether we should have some PowerPoint slides. I said no, most of the magic is going to happen in the room. Yeah, and
Yeah.
I think you saw the magic that happened. Yeah.
Yeah.
So
So
thank you very much. Have a nice rest of evening, afternoon. Thank you very much.
Thank you,
thank
Samir.
you very much.
Thank you
Thank you.
so much.
Thank you. Bye.
Thanks.
Bye
Thanks,
bye.
William.
Thanks.